we've been having several concerned folks from Arlington and neighboring communities that are concerned about their symptoms. And we have set up a triage for our COVID-19 patients through our website. So they can actually just log on and discuss, put in their symptoms, at which point my team is able to contact them via phone call to say, can you register online or through email, so that they don't have to actually come into the clinic right away if they're not feeling good. And we encourage them to do that at home, and they are sending us the paperwork back. We're having them speak to a provider who is then assessing them for their symptoms, and we are doing the COVID testing in our back parking lot. I'm not sure if you're familiar where we are located. We are in Arlington Heights.
Right.
Yes, so right around Massage Envy and what's that?
We're right across from the T station, the bus stop.
Right. Okay, good. So you're conveniently located, without a doubt, in Arlington. Now, have you had anyone come into your facility and test positive for the coronavirus?
Yes, we had two tested positive as of yesterday.
And from what I understand, as of this interview anyway, the confirmed positive cases stands at 12. Is that what you're hearing as well?
Yes.
Yes, correct.
Okay. Now, what happens with people who may be, a lot of people are concerned, obviously. This is a pretty tense time for everybody, but is anyone just worried they have it? They are showing absolutely no symptoms whatsoever. Are they calling you up and saying, hey, I just want to be tested? What are you hearing?
Yes, so Jeff, that is true. There are plenty of people out there who are worried about it or may have been exposed to the coronavirus through household contact or someone else. And obviously there's a concern. And asymptomatic carriers is a concern for all of us, because those are the people who don't have symptoms who can spread the virus. And that's one of the things I think that the CDC, the Center for Disease Control, is saying, that we don't need to test the asymptomatic people. But when you start looking at the successful countries like South Korea, where they have had success in controlling this and flattening the curve, as they say, has been because of widespread testing on everyone. And so you can identify that asymptomatic patient and tell them to quarantine themselves. So obviously we are behind in that. We believe that everyone should be tested. I think the biggest thing in the United States we've had is a lack of testing. And then the bigger lack right now is a lack of protective equipment for the people who work with us, our valiant and courageous workers here and doctors here who are going out and seeing patients and testing them. We obviously have done a very unique thing over here, where to reduce the chance of transmission to our healthcare workers. Because for your listeners and readers, the important thing to understand is if we knock out the healthcare workers, they're gone for at least 2 weeks. So to try to keep our very limited healthcare community intact, we have initiated a telehealth system where, the patient calls in, we can screen them over the phone and then decide if they need a test or not. I'm hoping with more widespread testing that we can test everyone who has a concern, because I think from a public health perspective, that would be the ideal situation. Just like South Korea and China and Singapore and other countries have done. I think the Western world is a little bit behind in this, but I'm hoping with opening of supply chains, it's hard for us to get gowns and gloves. We're wearing masks right now. We're not maintaining a social distance of 6 feet for this interview, but there's only so much we can do, because we're doing this as a public health message. But there are unique things we've done using telemedicine to help people. I think the other thing that's important for your listeners and readers to understand is we get a lot of phone calls saying, why is the test not free? Well, the test is free, but there are 3 other components to it which are not paid for. That is why the telehealth visit, and it's important for the people to understand what a telehealth visit is. It's like a doctor's office visit, except for it's through a video chat or a telephone chat. So the government is providing free tests, but they don't pay for the people who have to go out and do the tests on you. They don't pay for the supplies that need to go in to collect the test. And so those are the 2 important components, because without that, having a test sitting in the corner is useless. You still need people to collect it. We need people to put it in a vial and then send it to the labs. And then the labs themselves are getting paid by the government for the actual testing they run. So that is the two components which I think people are getting upset at us as well, that why do we have to do a telehealth visit? Because number one, we're trying to follow the CDC requirements that we've got to screen people, and all my providers do that. But at the same time, the healthcare providers are taking a lot of risk to come out, whether it's in your car or bringing you into our center. We have to pay for the personal protective equipment. We got to preserve this small healthcare community out there so that we can continue to function as the numbers go up. Also, just to backtrack for your article, I would confirm the number of positive cases in Massachusetts, because I think it's up to 200 now, not 12. So you want to confirm the last number because it's updated this morning.
Right, that 12 was just in the Arlington community. How much does the test cost? I'm just curious.
So we at this point have no idea what the cost would be to us. We have been out in the front line since this whole outbreak. We are providing the testing without knowing whether we're going to get paid for any of this.
Wow.
We just want to be out there for the community, because without knowing that you have it, you are not going to be able to protect people around you. So to date, we have no idea what these local labs are going to charge us. The only thing that we have made it public in our website is that we are going to, if someone has no insurance, we will charge $199, and in the event their insurance covers it or anything such as that, we will refund. We have no idea. We are just going out there blindly and helping the people right now.
So everything right now is up in the air.
Yeah. So for you to understand as well, so AFC Arlington and Watertown, we're a small business. So, we will keep on going and serving the public as long as we can, because, ultimately it is a financial business. And at some point, if we don't get paid, then we'll have to look at other contingencies. But right now, we're doing whatever we can out of our own personal savings to help the community in Arlington, Watertown, and surrounding communities. We'll do what we can as long as we can.
What are you running short on as far as PPEs for yourself to protect yourself? Because you guys, everybody's practicing social distancing. You can't, quite obviously. So what are you lacking right now that you're very concerned about just for your own safety?
So I was just told by my chief medical assistant that we are down to 2 N95 masks. And that is actually a very critically low number. It would be nice if we get more N95 masks. That would give the front team that's out there testing more comfort. They are the ones right in the line of fire, basically, if I may say so, and doing these swabs and tests. So we would encourage, if any construction companies in Arlington have unopened N95 boxes that they can donate us, we would really, really appreciate that.
Paint shops use this as well. So what we really need is N95 masks. We need these face masks that we're using. I just got a donation from a very nice dentist, because most of the dentist offices are closed. So they just knock off 100 masks. I'm wearing one of them right now. Gloves, gowns. So those and face shields or eye shields. Those are the minimum things we need. And obviously, as you know, supply chain has been hit hard in the United States. If we don't have that equipment, we can't really do much beyond that time. We may have the test, but we won't be able to collect it without it, because we can't endanger the people that are working here either. So we're doing our best, but if your readers or anyone out there who has N95 masks, face masks, eye shields, or gowns, maybe someone who's closed down their office while this is happening, if they can drop it off to our Arlington location, will be extremely helpful in the name of public health to save our people.
I understand that. What is your website? What is your phone number if they want to get in touch with you to deliver some of these much needed supplies?
Sure. Our phone number is 781-648-4572, and the website is AFC Urgent Care Arlington.com.
All right. Thank you very much, and good luck. I hope some people can respond to your need, because if you guys get it, you're out at least for 2-3 weeks. So that takes one person out of the mix to give the test. Now, I'm hearing a lot of the symptoms are like a dry cough, fever, lethargy. But I'm also hearing that some of the symptoms could be lack of smell and lack of taste. Is that true? What symptoms are you seeing?
we are definitely seeing that in the folks that are triaging on our COVID triage, concerned about the symptoms. Um, some have mentioned lack of taste, lack of smell, but primarily the key ones that we've noticed are the dry cough, fever, lethargy, and breathing problems.
Now, this morning I was reading that in Wuhan, China, that they flattened the curve. They haven't had too many cases, but I understand on Tuesday, someone tested positive for the coronavirus in Wuhan after testing negative. So are you worried about a second wave here? Or I guess it all depends on how we behave.
Yeah. No, that's a very good question, Jeff. And the reason we worry about that is that we don't have a system like some of these Asian countries where they can put masses under curfew, for other words, right? There are still people walking around. There are still people not socially distancing themselves. We've seen that in the news media, people go to beaches and stuff. It's those people we worry about, right? Like me and you sit at home for 14 days. When we come out and we interact with those people, guess what? We can get the coronavirus again. So I think the whole idea behind quarantine, the ideal situation, the gold standard would be that everyone goes into quarantine at the same time. We sit it out for 4 weeks and then we come out, right? Now that's not happening. And I think that's what China is talking about, that they controlled it in the local population through these strict measures, but now they're getting this influx of people who are abroad, who are coming back home or back to the jobs or whatever, and they're bringing the coronavirus.